Hello everyone. Today we'll revise facial nerve. Facial nerve is the seventh cranial nerve. It runs from pons to parotid, P to P. It is a mixed nerve, so it has following components like spatial visceral efferent, general visceral efferent, spatial visceral afferent, and general somatic afferent. If we look for the journey of facial nerve, it runs from pons to parotid. In the pons, there is a motor nucleus from which facial nerve originates, and from this motor nucleus up to the internal acoustic meatus, the part of the facial nerve is called intracranial part. From the internal acoustic meatus up to the stylomastoid foramen, the part is intratemporal, and from stylomastoid foramen up to the parotid gland, the part is extracranial. In the intratemporal part, it has four segment: meatal segment, which is confined within the internal acoustic meatus. The labyrinthine segment, which is also called the bottleneck of facial nerve, is from fundus of meatus to the geniculate ganglion. A ganglion located near the first genu of the canal. Then the tympanic segment, also called the horizontal part, it lies in the medial wall of the middle ear and is the most common site of dehiscence of canal and is the most commonly injured segment in ear surgery, particularly the second genu area. And finally, the mastoid segment, also the called vertical segment, it lies on the posterior wall of the middle ear. The tympanic segment lies on the medial wall of the middle ear and the mastoid segment lies on the posterior wall of the middle ear. Then it runs through the mastoid bone, and finally this part descends vertically to come out through the stylomastoid foramen. So this is a very simple diagram for facial nerve. Suppose this is the internal acoustic canal and this is the stylomastoid foramen. Facial nerve enters the ear through this internal acoustic canal and comes out of the ear through this stylomastoid foramen. And inside the ear it passes through a bony canal called facial nerve canal or fallopian canal. In the facial nerve canal, the nerve gives rise to some branches. Like from the first part, that is the labyrinthine part, it gives rise to greater superficial petrosal nerve, which supplies the lacrimal gland, and the efficacy of this nerve can be tested by Schirmer's test. From second part or the horizontal part, also called the tympanic part, it gives rise to nerve to stapedius, and as the name suggests, it supplies the stapedius muscle and the efficacy can be tested by stapedial reflex. From the third part or vertical part, also called the mastoid segment, it gives rise to chorda tympani nerve, which supplies the anterior 2/3 of the tongue, and the efficacy can be tested by taste sensation. And sometimes a branch called posterior auricular branch, which originates from this facial nerve third part, supplies the external ear or pinna. Finally, from exiting through the stylomastoid foramen, facial nerve ends on the parotid gland. And a very common type of palsy in the facial nerve, which is mainly idiopathic and sudden onset, is called Bell's palsy. So this is all about facial nerve. Thank you guys for watching.